Good, glorious morning here in East Texas. This is Dr. Chris Baker, and I'm coming to talk to you today about choice. This week I've been focusing on choices. So many choices, and so little time in which to make those choices. We get so busy that we forget what power we have in our choices. I heard a great saying the other day from one of the doctors that I work with, Dr. Christine. She said, if you're waiting for that person to come and change your life, you better look in the mirror. It's your choice. And choice is actually the most powerful tool we have. We can choose anything in the field of infinite possibilities. It all boils down to choice. The thing is, if we're waiting for our life to change, as we said before, then we need to change. There's only one way that your life is going to change. As Albert Einstein said, doing the same thing over and over and hoping for a different result is the definition of insanity. So what do you want different? What do you want to change? What do you want to happen differently in your life? Here's a better question for you. What choices did you make that brought you where you are today? You made a choice to go to dental school. You made a choice to practice. You make choices each day to go in and see your patients. You make choices as to how you're going to deal with certain things in your practice. Think about it. What choices have you made that bring you to where you are today? And which of those choices do you want to change? Maybe it's best to look at what you want the change to be, the result to be. So what are some of the choices that you can make? Well, you can certainly choose to be kind and compassionate. And that entails a certain amount of courage. Why? Because our first reaction to anything that scares us is fear, obviously, and anger, which is fear. And if we want to be able to go past that, we have to live with the idea in a constant way of making the choice to be courageous. How upsetting is it to you when your staff member comes to you and says that Mrs. Jones is there and she's complaining again about the crown that you did? How does it feel to you when you know that your main principal assistant is out sick and no one else can do her job well? And you say, what kind of choice do I have in those situations? The main first choice is how you approach it, how you see it, how you approach your own reaction to it. Fear, the day's going to go to hell now, is not the best choice. The best choice has one that wraps around compassion, understanding, patience, all of those things. So we can choose to be those things, and we enter into the day that way. But we have to remind ourselves every single day to do it again, every single moment as something stresses us. Our son Trey has a saying that he uses that's really fantastic. It's called STOP. He calls it STOP. S stands for stop in the middle of your angst. T stands for take a deep breath. O stands for observe. And he goes on to say, observe yourself. And P, proceed with joy. That's how he manages when he starts to feel upset. That's how he has taught me that it can be managed. And I wonder sometimes how much better I can get, because I really have a long ways to go. Most of us do. Because our first emotional reaction is one of upset or fear when something's not going well. It scares us. How am I going to manage my day? How am I going to deal with Mrs. Jones? What am I going to do for her? Nothing seems to please her. So choice is a powerful tool. But before we can make choices, we have to understand what they are. And we can start with compassion and patience and courage. We can choose happiness. We can choose to be joyful. We can choose to understand better. You know, if we understood how Mrs. Jones was feeling, she's probably putting things from her life into that crown. It probably has very little to do with anything you've done. And she just needs to have something over which she can have control, or have it fixed, or have it better, or have it not bothering her. It's like a prick in her side because she's already so upset about her life. If we knew how hard she perceives her life to be, we would not be upset with her, but rather we would be more compassionate. But that's hard to do because we have our own amygdala, we have our own ego, we have our own needs, our own fears. Okay, so those are choices we can make. Then I want to refer you to a book by Jim Rohn called 12 Pillars, which is about 1/4 of an inch thick. It's a fantastic little book. I would suggest a good read for you. And it has 12 areas, 12 pillars, 12 areas of choice that you can make. Let me see if I can recount them to you. Because my husband and I, Claude and I, have memorized them and say them back and forth to each other to remind ourselves of the 12 choices that we can make on a constant basis. And do we forget to do them? Yes, of course. Okay, let me run through them for you here. The first choice is work on yourself more than on your business. Work on you, just like what we've been talking about. If you want change, you have to change. That's the first pillar. The second pillar is 3-dimensional health, and that is physical or body, mind, mental, and spirit. And those are areas that we can all work on, of course, every day. The third pillar is relationship, and that is how we interact with people, both our loved ones and our patients and our staff and all the people in our lives. Relationship. The fourth pillar is set goals and move toward them. Instead of just having a goal of getting to the office, let's have a goal of making the day fantastic. Let's have a goal, a short-term goal of having a day that is full of happiness and joy, for example. The fifth one is, let me think. I can tell you that the sixth one, I'm going to skip, the fifth one is what, Claude? And the sixth one is hang with the right people. Surround yourself with the best people, the very best people that you can think of, to help motivate you and encourage you and tell you when you can do better. The seventh one is
lifelong learning.
Lifelong learning, thank you. Keep learning. That's what we're doing here. Keep on becoming. Keep on growing. Keep on looking forward and working toward the constancy of becoming greater. Then we have one called all of life is sales. All of your life is presenting as if you're selling yourself. Indeed you are. You can so do this. You can so always be presenting yourself as the person that you want to be and as the person that will help other people the most. And then finally, the one that pairs with that in my mind is that your income rarely exceeds your personal development, which yanks you back to lifelong learning, which yanks you back to you need to change if you want your life to change. So your income rarely exceeds your personal development. Work on yourself more than your business. And then the next one is communication. And communication, of course, again, they all interweave. Communication is how you communicate, talk to people, get people to understand. And of course, I love the saying, and I don't remember who said it, that the problem with communication is the assumption that it has been successful, because often the other person has no idea what it is you're trying to get across to them. And then finally, we have leadership. And as dentists, oh man, are we leaders. We are dependent upon by our staff. We are dependent upon by our families. We are dependent upon by people around us to be a leader in every aspect of our lives. But take that challenge, take that and become that. And finally, leave a legacy, which is exactly what you're doing when you are working with your leadership and your people and loving and caring for them. And I skipped number 5, so let me go back to it. It's time, how you use your time. And that might be good to end on it, because time is actually something that we have very little of, not enough. Time is something that we never get back. And time is something that is ever so precious. So those are 12 areas of choice for you, and I would recommend to you that you think about which ones speak to you today and how you're going to utilize the idea of choice. Remember, if you want your life to change, you need to change. Dr. Chris, signing off.